The most important step in an upper blepharoplasty or upper eyelid lift is the measurements of the excess skin that needs to be removed. By far, I believe that this is the most important step of the operation, because once the local anesthesia is given, we can't really determine how much skin to remove. So I have carefully marked where the patient's crease is going to be and how much is going to be removed by pinching between these two lines. The important thing is to be conservative, especially on the inner corner, because the last thing you want for the patient is for their eyes to stay open and not be able to close the eyes after surgery. If you want more information, do get in touch.